Hello, I'm Dr. Paul Gilbert. I'm here to discuss a serious problem in the ICU and our solution to this very common problem. Critically ill patients in the ICU develop stress ulcers and gastrointestinal hemorrhage. In almost all patients, endoscopy shows severe gastritis. In fact, clinically significant bleeding occurs in about 2 to 6% of all patients in the ICU. Clinically significant bleeding being defined by hemodynamic compromise, need for blood transfusion, or need for endoscopic intervention or surgery. These complications lengthen ICU and hospital length of stay, add additional expense, and cause significant morbidity and mortality. Because these complications are so serious and costly, it has become standard of care to raise gastric pH in the ICU setting. Multiple studies show that giving H2 receptor antagonists, proton pump inhibitors, and other medications to raise gastric pH prevent significant bleeding. Dosing of these medications can vary from patient to patient and can be difficult in critically ill patients. On the label of many of these medications, it states to raise gastric pH. Dosing of the medication in critically ill patients has not been determined. Multiple studies show that monitoring gastric pH closely and maintaining it above 4 reduces the risk of bleeding. The majority of patients in the ICU have a nasogastric tube already in place. Gastric aspirate through the NG tube with pH paper to check pH has been shown to be as accurate as an expensive pH probe. With these facts, one would think that gastric pH would be monitored in the ICU setting, but that is not the case. Monitoring gastric pH in the ICU is not common practice and is rarely done. Why is this true? Currently, to check gastric aspirate pH, the clinician would have to express the aspirate onto the pH paper and compare it to a color key. This can expose the clinician, other healthcare professionals, and other patients to bodily fluids. The other option is to send the aspirate in a test tube to the lab. This could take a significant amount of time, reduce the accuracy, and is expensive. EasyPH now has a rapid bedside test that will accurately give a reading without exposing the clinician or patients to bodily fluids. The aspirate never leaves the inner chamber of the indicator. The indicator also has a color key on the device, so a rapid comparison and pH determination can occur. By using the EasyPH indicator regularly in the ICU to test gastric pH and adjust medications according to the pH reading, we can prevent gastric ulceration, GI bleeding, need for endoscopic or surgical intervention, prolonged ICU stay, and death from gastrointestinal bleeding. Before placing the indicator on the nasogastric tube, one must pull back on the syringe. 10 mL for adults, 5 mL for children, 1 mL for infants. After the tube is in place the indicator on the proximal end of the tube. In order to ensure the distal end of the tube is not attached to the stomach wall, insufflate 10 mL for adults, 5 mL for children, 1 mL for infants. Aspirate stomach contents holding the syringe vertically with the tip pointing down to obtain at least 20 mL of aspirate or until saturation of the indicator.
View the color change on the pH indicator and compare to the color markings on the shaft. Document the pH value according to your institution's policies.
To remove the indicator, do not pull apart the indicator from the syringe. Hold the indicator above and away from the patient's head and body with the tip of the syringe pointing down. Pull the nasogastric tube out of the indicator. Discard the indicator and syringe according to your institution's policies and procedures. Thank you for viewing this video. If you would like more information about EasyPH, please visit our website at www.easy-ph.com.